Hi, my name is Dr. Davis. I'm a family doctor here in Edmonton, Alberta, Canada. I'd like to share with everyone how to present medical information on a worksheet so that you can save time when you're seeking medical attention. I'm in Canada, but I think this information can be probably shared and used anywhere around the world where the functional language would be English. So, and of course, for American friends, feel free to share this information as well. Even if Donald Trump doesn't want to share N95 masks with us, we're still, quite willing to share additional resources with you. And so the goal of this video is to help everyone understand the symptoms of COVID-19 and how to present your medical information on a worksheet so that when you do go into the hospital or you're seeing the 911 ambulance emergency crew, that you can present the information in a really quickly and organized fashion so that the healthcare provider doesn't have to spend time on collecting basic information, but rather spend that time on assessing your condition. So before you seek medical attention, we always want to remind you that you should use an online self-assessment tool before you call 911 or call your family doctor, for example. And for example, the Alberta online assessment looks like this. You would need to go through a series of questionnaires, and if you do need to seek medical attention, it will prompt you to do so. And so in many jurisdictions, there should be an online assessment available, so please look up depending on where you are. So first of all, going through the symptoms of the coronavirus, there's many symptoms that overlap with other conditions. That's why it's so hard to diagnose coronavirus just simply based on symptoms. There isn't a single symptom that can tell us you have or do not have the coronavirus. In fact, if the other problem is that when we do respiratory swabs for patients, you often see that there's co-infection with multiple types of viruses, so that even though we know that the coronavirus typically would not cause a runny nose, you still probably would see patients presenting with fever and a runny nose and then turn out to be COVID-19 positive. And those patients might even be actually presenting with the second virus that they contracted at the same time. And so, again, we cannot diagnose based on symptoms, although we do understand that some symptoms are more common and, of course, are more alarming for COVID-19. And the most common symptoms are, again, fever and a dry cough, followed by fatigue. Many other symptoms are also present and widely reported. And as the disease has been progressing, we have also picked up on additional symptoms that I have all listed on the worksheet. And so this brings us to the worksheet that I've constructed. You might be able to find a different worksheet online. I wasn't able to find one, so I decided to make one for my patients, and I hope that if people find it useful, you can again share this worksheet with other people. And so for this worksheet, of course, you would want to list your name, date of birth, and I've put a reminder here that if you do need medical attention, please call 811 or your family doctor, and don't go to a medical facility directly in case you further spread the infection. One of the most basic pieces that we need to know is your past medical history. And here is something that we often encounter. We ask a patient, do you have any medical conditions? They say, no, I'm healthy. And then we ask them what medications to take, and they take out a whole bag of medications. And so we want to remind people, to think about this ahead of time, to list all your medical conditions, because many of these conditions are risk factors for poor outcomes of COVID-19. For example, heart disease, lung disease, chronic kidney disease, diabetes, cancer, you name it. And so the other thing is that if you do have such chronic medical conditions that are deteriorating, even if your COVID-19 symptoms are not very severe, you should still be seeking medical attention. And so if the history is very complex, you should probably have prepared this ahead of time on a separate sheet. If you have not, it would be advisable that you list those conditions on this worksheet. Second area that is very important, medications. We want you to list every medication, how much you take, how often you take, and please prepare this ahead of time, because I encounter this so many times. You might be in the clinic or in the emergency department. You ask the patient what kind of medications they take. They tell you, I take the yellow pill or the white pill or the house-shaped pill. And honestly, doctors do not remember these medications by color or shape. Please tell the doctor exactly what you take. If you have a list from your pharmacy, that would be great. If the medications are very lengthy, you probably need to attach a second sheet rather than writing them out yourselves. Next, treatment history, what you've done for this particular episode of infection. I would like to remind everyone to do not, for now at least, do not take ibuprofen for fever. You might be at risk for poor outcomes, although this is not yet proven. We also know that fever is probably helpful for managing an infection, and it improves the immune response. So if possible, it's probably preferable that you do not limit a fever when you're suspecting yourself of having COVID-19. For treatment, please tell the doctor what medications you've tried so far, over-the-counter remedies or physical remedies that you've tried. Maybe you've gone to see another doctor or health facility already. It's not uncommon. At the end of my assessment, I've told the patient that I'm ready to prescribe some antibiotics, and the patient tells me they went to the emergency 2 days ago and they're currently taking an antibiotic. And so this is all very important information that you want to present before the doctor starts questioning you. Next, contact and travel history. If you've been around people who've been sick, even if they haven't been diagnosed, that's helpful to know. If, for example, you're American and you've gone back to your home state and recently you've traveled to New York, which is the epicenter, that information is very important. For supplements, any sort of supplements, you still want to let your doctor know, even though most of them are benign, do not interact. But sometimes they might interact with certain medications. So if you can provide a list or write them out, that would be helpful. Social history, generally we're looking for your information, what kind of job you do, who you live with. If you happen to be living with many people, then public health might be tracking them. If you work in a nursing home, for example, that's going to be very important, because public health will need to go into that facility and might be preparing preventative measures. On the side, I've listed allergies, smoking. For the allergies, please list out which medication and what kind of reaction. If you're a smoker, please write how many cigarettes you smoke per day. If you use vaping or marijuana or any illicit drugs, all of these should be listed because they might adversely affect your immune system. And without question, if you are still using any of these substances, this is the year to quit if you do not want to die. If you've had vaccines that might protect you against infections, it might be helpful to list them. You should also probably check your heart rate, blood pressure, and respiratory rate if you can do so. That can help the healthcare provider assess how severe your condition is, especially if you're calling for a phone or video assessment. Respiratory rate, that's something you can count, how many times you breathe per minute. If you have an oximeter, you can also measure your oxygen saturation and report it. Some other information that you might want to attach would be your goals of care, whether or not you want to be resuscitated, for example. In case you cannot provide any information, your personal directive would tell the healthcare provider who is going to help make medical decisions for you. Again, if you have a medical history or medication summarized on a different sheet, you should attach it to your worksheet, especially for those people with complex medical conditions. Now, going on to the symptom portion of the sheet, we want to know how long you've been sick exactly. Quite often I ask people, how long you've been sick? They say, it's been quite a while. It's been a number of days. It's very vague, and different people mean different things. If you've been sick for a long time, some people mean it's been more than 10 days. Some people mean it's just been 3-4 days. So please list out the date since the point you actually got sick. And that's going to be really helpful to document your history, how you've been progressing. Next, fever. This is also very important for you to have a thermometer and to actually write down the number for your fever. If you can, also write down how you measured it. Was it in the armpit? Was it a year temperature? Because depending on how you measure the temperature, it may or may not be considered a fever. This is a very basic thing, but over and over again, healthcare providers ask if you had a fever, and people just say, I've had chills, I feel like I've been sweaty, and the information could have been collected ahead of time so that we're not asking redundant questions. Regarding fever, again, if you're not sure if you truly have a fever, the gold standard would actually be to take a rectal temperature. It would be the most accurate. I personally prefer taking it by the year, a little bit closer to our central temperature. Many of you might be using an oral temperature, forehead temperature, armpit temperature. These temperatures are more variable. Again, depending on the method, the temperature may or may not be considered a fever. For example, 37.8 by armpit might be a fever, but not for a year. So, going on for the symptoms, if you have a cough, you can list that cough, which days you've been suffering from the cough, whether or not there's any sputum or phlegm, and even the color. If you've had a sore throat, runny nose, nasal congestion. If you're feeling short of breath, you should probably be seeking medical attention, either calling your family doctor or 811. You might have pain, your muscles, joints, chest pain might be indicative of pneumonia or inflammation around your heart, or even progression of cardiovascular disease in case you have underlying risk factors. Headache, fatigue, diarrhea, vomiting. We know that gastrointestinal symptoms are not very common, but for people who present with diarrhea, they actually have worse off outcomes. Pink eye is not very common, but has been reported. Loss of smell is often reported for early presentations and relatively asymptomatic presentations, so that's also something to watch out for. And I've also left a space on the bottom for other, in case you have other symptoms that might be not listed but possibly relevant. And so here I've provided a sample of version of how you might list your symptoms. This is on a previous version of the worksheet. Here we got someone who's got a very similar name to the American president. He apparently has a history of COPD, schizophrenia. He's got his medications listed. And he's been saying that recently he's been using his Ventolin very frequently. And he proclaims that he has not traveled, but his coworker was diagnosed, and he's taking some multivitamins as a supplement. And he reports that he works as a CEO, but he lives alone. And he has some risk factors for lung disease because he does vape and use marijuana, although he's tried to protect himself by getting the influenza and pneumovax vaccines. And so here he's reported his symptoms. The first 2 days he wasn't taking his temperature, but then he started taking the temperature, and here for the healthcare provider we can see that there has been a progression of his fever, and it's been getting higher and higher. He has noted how long he's had a cough, how long he's been actually changed from the initial day being a dry cough to a productive cough and having sputum, and he's noted that it's been clear sputum. And here he's listed initially had a sore throat and some runny nose, but those symptoms resolved. He's been having some shortness of breath, and maybe that's now why he's asking for medical assistance. He's had some muscle joint pain, chest pain, and he's been fatigued. And as well, and on the bottom, you can't see it here, it's blocked up, but he's been having some dizziness. Palpitations, sorry. And so this way, if you present this medical information to a healthcare provider, it's already been listed in a very organized way. Everything that I would need to know to assess a patient, it would be presented in here. And I would, ask very few questions and then just be able to proceed to assessing the patient. I'm going to give another example. And by the way, I've been making bilingual versions for my Chinese patients because many patients have trouble describing their symptoms in English. And here on this bilingual version, I've log the symptoms in a slightly different way using plus signs so that you see that this person has been increasingly more fatigued and that his cough has been progressively getting worse. And I've color coded the colors on here so that you can see that he started out with clear sputum and then progressed to yellow, then green, then eventually bloody sputum. So this, again, information that describes the progression of your disease, everything is listed chronologically, and so that your healthcare care provider can really get to work on you as quickly as possible rather than asking those basic questions. Okay, so one more thing I just want to mention is that if you do have red flag symptoms, these are symptoms that generally are very dangerous, and you should be calling 911. So shortness of breath at rest, difficulty breathing, chest pain, mottled skin, usually indicating poor perfusion at this point, confusion, being difficult to rouse, having blue lips, little or no urine output, again, no circulation by that point. And if you're coughing up blood, this doesn't mean just streaks of blood, this means probably coughing up frank blood, usually indicating a more severe condition in the lungs. So here again, I hope this video and this worksheet can be helpful for you. I guarantee you it will save time. Please share this information, and if you have any recommendations, please send an email to my clinic email address. If you want to, for example, also maybe help us design this worksheet to look more aesthetically pleasing, please help us. And so there you go. And I've made some other videos about how to wear a mask properly, so if you have the time, please watch that one as well. Okay, thank you very much.